Hey, welcome to this episode of Medicine Monday with Dr. Walker. All right, today we're going to talk about insulin. No, we're talking about diabetes. That's much better.
Yeah, we talked about insulin last time.
We did. Okay.
If you want to be fat, take insulin.
If you want to be fat, take insulin. All right, so what is the difference between type 2 diabetes and type 1 diabetes?
Okay, so type 1 diabetes typically comes on juvenile onset. It used to be called juvenile onset. You develop antibodies to the pancreas, and the pancreas kind of destroys itself. You have to be on insulin, or you go into diabetic ketoacidosis, DKA.
And you have to be on insulin because your pancreas isn't producing insulin.
It's not making it, so we got to give it to you. And typically these patients do very well on insulin pumps, and the endocrinologists manage all type 1.
Now, how is that different from type 2 diabetes?
So type 2 diabetes is the more common diabetes that we get as we get older and heavier. We don't want to say the F
obese.
Word. Yes.
So there's a big, strong correlation between type 2 diabetes and obesity. Is that correct?
Yes. In fact, there's a new term called diabesity that's getting a lot of... Yeah.
All right. So, and what's happening in the body when someone becomes a type 2 diabetic?
Okay, so the key is you become resistant to insulin. So instead of getting a normal response to glucose where you would put out like 10 or 20 units of insulin, your body has to produce even more to get the same kind of response. And so your pancreas starts to burn out and not produce enough.
But your pancreas is producing insulin,
yes,
but your body is not responding as much. Is that correct?
Right. That's absolutely correct for type 2s. Right.
So the question I get a lot is, can a type 2 diabetic suddenly turn into a type 1 diabetic?
Yes, it's not very common, but it does happen, and we call those, there's a couple of different names. One is called a tweener because you're between a 1 and a 2.
My daughter's a tweener. She just turned 11, so she's in between 10 and teenagers, so she's a...
The other term you might hear is a type 1.5.
Oh.
And so those folks do need to be on insulin, and sometimes there's other factors that can cause you to become a type 1.
There's been a lot of really kind of interesting research about the cause of diabetes, and there's some sort of theories on a viral mechanism. Is that right?
That's absolutely correct. So they theorize that a virus attacks the pancreas. So these are for the tweeners. It's not a classic type 1, but they turn into a type 1 in the sense they have to have insulin. And they typically are overweight, so they were a type 2, but then they got a virus that's theorized. I'm not aware that they've identified the actual virus, but that's...
And currently in the surgical world, they're doing a lot of research on weight loss surgery to affect type 1 diabetes. That data is still kind of mixed and ongoing, but we have pretty strong data regarding weight loss surgery and diabetes type 2 resolution. You want to speak to that?
Right. So, like the gastric sleeve procedure, which is the procedure that we prefer, it is a metabolic surgery. It does things beyond just the reduction of the volume of the stomach. And so there's a lot of cool research that's being done on all the mechanisms. One of them is postulated that it increases GLP-1, which is one of the medications that we use for type 2s now to help them get off of insulin. So lots of great research being done for surgical patients.
Type 2. And the strongest research is actually with bypass and resolution of type 2 diabetes.
That's correct, but still the sleeve is getting a lot of good results, just as much good results as the bypass, but the bypass is a little bit better.
Well, that's true, but I think the way that we do it by combining a sleeve with the low-carb ketogenic diet and your control of their medicine and insulin and stuff, we've had great results.
We have had great results. Like, we have some fantastic dietitians that are working with us that are really getting fantastic results.
And by fantastic results, I'm not talking about weight loss. I'm talking about resolution of diabetes.
Diabetes.
I want to be very clear about that.
Lipids, blood pressure, everything gets better. Like, what doesn't get better?
I don't know.
Get your cert. Like, we want to identify...
Dating? Maybe dating.
Right, well... Good luck on that. We can't help you on that. Sorry, guys.
Well, I strongly believe that every bariatric surgeon needs to partner up with a guy like Dr. Mark Walker over here to control some of the non-surgical and bariatric issues and medical issues. So, hope you guys enjoyed the video. This is a new segment I'm going to work on, Medical Mondays with Dr. Mark, and we'll keep this up. Comment below if you like it. Ask us some questions. Put some topics you might like for us to discuss.
Topics. Yeah.
And we'll be back every Monday. All right, see you next time.
Adios.